Acha. So now pleomorphic adenoma, which is basically a benign tumor, very important. We have here. Okay. So let's start it. Bismillahirrahmanirrahim. Pleomorphic adenoma, basically it is benign. Yes, it is a benign tumor of salivary gland, which is the most common salivary gland derived from the cells of ductal and myopithelium cells. It is a mixed tumor. You will get to know why we call it mixed tumor. The parotid gland is involved. Then you have submandibular. Then you have minor salivary glands are involved. Why we call it basically? It is a mixed tumor because it has a different sizes and shape. This gland has different sizes and shape basically, and you can see the adenoma means glandular, oma means benign tumor. Okay, then again the composition has been shown here, which is the most common salivary gland again. Okay, then you have, okay, moving towards the histogenesis. Histogenesis has shown that it is derived from myopithelium cells, and the cells are also involved, the cells of the ductal. Okay, very important. It can be asked in your MCQ. This is very important. Tumor pleomorphic adenoma. Okay, acha, how it occurs? Basically, there is an overexpression of a gene, PLAG1 gene, basically which is present on the long arm of the chromosome 8. Basically, okay. So it is a cytogenic abnormality, means it involving the genes. Okay, it can have also the chromosome region like, you can have the chromosome like 12 is also present, and it has locations like 13 and 15 is like they're specifying the location. They are concentrated with the pleomorphic adenoma. Okay, radiation exposure is one of the factor, might be. Okay, clinical features: the patient will be a young either or middle age. It is basically occurring in the females. It is a painless and slowly growing, but the patient is aware of the mass of months or years before its diagnosis. Okay, it is basically in the parotid gland, mostly occur in your superficial lobe. Always remember, facial nerve palsy is rare with this, means it hardly affect the facial nerve. Okay, then basically that as you can see here, this is a whole gland. Okay, so over they are saying that it is present right in front or slightly below the ear. You can see slightly below or in front of the ear. They are saying. Then the tumor is mobile, less mobile as it grows. They are saying initially what happens, it is mobile, movable, but as it moves or it grows, it becomes fixed, hard. Bilateral, it is very rare. Synchronous or metachronous. Okay, so basically what happens in synchronous, it happens that the tumor is bilateral, but it does not occur at once, means first it will occur at one side, then after months it will occur on the another side. But in metachronous what happens that the tumor is bilateral, but it occurs at the same time bilaterally, means you will have on both sides of tumor on the same time. Okay, then basically a female, again they have discussed about the clinical features. Okay, so palatal glands mostly commonly fact. In minor salivary gland the palate is involved, so it affects. Okay, 4 to 6 decade होता है, slowly growing होता है, superficial lobe they are saying. Then slowing is below the ear or in or front of ear. Tumor can grow in large size again, that whole. Okay, coming towards the macroscopic appearance. Basically, it has a very irregular ovoid mass, basically with a well defined bodice. Tumor is encapsulated. Very important point that this is encapsulated. Okay, maybe incomplete. In minor, the capsule is absent. Okay, in minor glands. Cut surface may be rubbery. Always remember, fleshy or mucoid and glistening with a homogeneous or white color. All very important that this has a rubbery, yeah, fleshy mucoid glistening with a homogeneous or white. The areas of infection, hemorrhage may be evident. There will be infection or hemorrhage. Either there will be a type of ischemia, no blood, or either there will be a hemorrhages. Okay, on that area there will be. You can see here. Histopathology, very important point. Okay, so number one, capsule. It consists of capsule which is surrounding the tumor and epithelium and stromal component. Capsule is basically made of connective tissue fibers. Then you have fibroblast. Then you have blood vessel. The capsule is made up of connective tissue fibers, fibroblast. Then you have blood vessels. Epithelium you has ductal epithelium, and then you have myopithelium cells. In stroma component, it is from the background. You will see now maxillary or either it will be chondrome, maxoid, etc. Okay. Here basically you can see the capsule. This is the capsule. This is the basically SNI is present here, and this is the whole tumor which is present here. You can see the tumor is here. This is the capsule which is surrounding the tumor. This is the SNI of the gland. Then epithelial component is basically present in 6 different shapes. You can say either it is you can have here. Okay, so basically it is squamous, flat. Then you can say the cuboidal, either you move. Then you have a clear. Then you have a spindle shaped it. Then you have basaloid, basically basaloid shaped it, plasma cystoid shaped it, or then you have angular. Okay, this is very important. Like you have S, C, C, and then you have B and P. One is squamous, then there is spindle, the other is cuboidal, then you have clear, then you have basal, then you have plasma cytoid. Cytoid. So always remember, it has the epithelial cell is present in 6 different shapes. Okay. Then again they have said the basically these are the shaped of ductal epithelial cells. Then you have myopithelium cells. Okay. Mm. Okay, so myopithelium cells is usually present in 3 shapes. Before it was actually the ductal epithelium we were discussing. Now myopithelium is present in basically you have SP. It is plasma cystoid, spindle. It is again an angular. Okay, it does not consist of angular. Okay, but it's so it has plasma cystoid, then you have spindle, then you have angular. Okay, then arrangement of epithelium cells. Okay, now whatever the shape of epithelium, myopithelium have different arrangements. Either will be in sheet form, either they will be in strand form, either they will be in duct forms. Okay, or rather they will be present in islands. So basically the epithelial cells and of the ductal epithelium cells and myopithelium cells are arranged basically in 4. Either it will be a sheet, then you have a strand, and then you have a duct, and then you have islands. Okay, you can see here the whole that this is a basically a strand, then you have duct, island, then you have sheet. Okay, then background stroma is either chondroid, which is a cartilage like, or either it is a mucoid, which is actually mucus cloudy. So what is chondroid? Mucus, osseous. Okay, then you have chondromaxoid both, and then you have adipose. Okay, so what you have chondroid, maxoid, osseous, then you have adipose, then you have okay, etc. Okay, as you can see, this is a chondroid form. Okay, this is a chondroid form. Okay, and then this is osteoid, mucoid. You can see the mucoid is light pinkish. Okay, always remember what happens in a chondroid. You will see leukemia. Okay, always remember it. In mucus you can see you cannot see the leukemia. Okay, then this is again a picture. You can see this is basically you can see it is a chondroid. There is a small leukemia is present. Here is also basically okay. It is chondromyxoid background. You can see the leukemia is also present, and basically purplish, or you can see light pinkish color. Okay, now discuss some what is basically myxoid. A myxoid area is basically separated and surrounded by mucoid material. Okay. So what happened? Myxoid areas are what? These are epithelial cells that are widely separated and surrounded by mucoid material. Okay. Uh, okay. The separated epithelial cells have long stellate processes. Will have a stellate processes like this and often appear to melt into mucous background. In contrast, what happens? The isolated epithelial cells appears as round cells lying in leucine. मतलब they are in leucine within the mucoid media, so the tissue comes to resemble the hyaline cartilage. When present together, they are called mexochondrite. Means mexo when both are present. You can see here this is both. Leucine is also present here. Okay. The composition of glycoaminoglycans and consistently mainly of chondroitin sulfates is produced by myopithelium cells within the tumor. So very important that they are seeing here. Okay, basically you can say the glycoaminoglycans. Basically, it consists and chondroitin sulfates, which is actually produced by myopithelium cells within the tumor. They are present here in you in these things. Tumor rich in mucoid material tends to rupture more readily during surgical removal and allowing spillage and implantation of tumor into surrounding tissue, giving rise to multifocal recurrence. So when there will be rich a tumor in mucoid, so when you remove it surgically, it will spell an implantation in surrounding tissue, give rising to the multifocal recurrence. Malignant transformation can occur usually in tumors that has been present from many years. You will take history from the patient. Okay, that what happens to the, you will see the age of the patient. Okay. Clean. Okay, then you can see the clinical examination also. Clinical examination is one of the factor, you can see it. Okay, in clinical features, what you say, you will ask for clinically that the patient is what age, either female or male, and then you will see the either it is painful or not. You will okay, you will see the patient mainly. Okay, you will do x-ray, then you will do CT scan, MRI, and then you will do PET scan for extension of tumor for biopsy, FNA biopsy or core needle biopsy, immunohistochemistry, epithelial cells positive for cytokeratins, MACA myopithelial cells positive for actin, vomiting, and 100 proteins histopathology. Treatment, either you will excise the parotid gland partial or superficial lobe or some if it's involving some meninges, so you will do the excision, and then if it involving the sublingual, so it will involve the okay. So thank you so much. If you have any questions or any queries about the topic, you can ask in the comment section.